Hello, everyone, and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation, and thank you for joining us. Now, our goal with the foundation, as always, is one, to make you better, to make you smarter, and to make you stronger where your health is concerned, whether it's your brain health, your mental health, your physical health. Today, we'll be talking about impotence, of course, referring to the male impotence. And if you remember, we've done a couple of shows on this before. I've done one myself, and we've also had the lawyer, the attorney, Mr. Chike Obieli, come and talk about some of the legal implications of sexual dysfunction, especially among males. And at that time, he gave us a statistic, which was, to me, was shocking, that 50% of most cases that they see, divorce cases, excuse me, 50% of most divorce cases can be traced back to this problem with sexuality and the inability to perform. Now, that's coming from a legal perspective. Today, we're going to be talking about it from a specialist's perspective. And on the show today, we have Dr. Undie, who is the consultant urologist at Kelina Hospital here in Abuja. Hello, sir. Welcome to the show. Morning. Thank you for making it. I know you have a very, very busy practice, and it's always great to have some expertise from your perspective. So we're going to really get into this. We're going to talk about some of the causes and what, most especially, what you need to do as an average person, not a medical person, because there are people who don't have access to urologists anywhere in Nigeria, where they are in Nigeria, and they are desperate for answers. And so we want to talk about, give people a better understanding, a foundational, basic understanding of why some things may not be working like they should, and what you can do in your own area to improve, shall we say, sexual activity. The term somebody gave was male non-performance. I don't know if that's a technical term, but so let's get on with it. Thank you again for making it.
Thank you, Dr. David. Happy to be here.
Great. So some of the causes. Well, first of all, let's start with your experience. I've kind of mentioned somebody else's experience. What's your experience with sexual dysfunction in Nigeria?
Dr. David, you spoke about male impotence, and I was curious because I don't know if there is any such thing as female impotence. Because the female actually doesn't need to have erection for her to be involved in sexual intercourse.
Very true.
My experience in this area of erectile problems or sexual performance problem, my experience is that most of the cases are not actually due to any surgical or medical illness. Most of the cases are due to relationship problems. And when you have a man and a woman having a lot of discord in their relationship, then the sexual activity between two of them will be reduced. And then, of course, if the man is not having sex with the wife, she assumes the man has a problem. And meanwhile, the same man is having some other women outside the home and is performing very normally. And for us in urology, we would like to talk to the man independently of the woman and then talk to two of them together. Because the information you get from the man alone may be different from when you are talking to two of them. If there is discord and the woman tells her lawyer she's filing for divorce because the man doesn't have any erection, the lawyer has no way of proving whether the man has erection in practice, in fact, or not. And so the lawyer tests it up, and then they end up in the court. And the proof, as far as the court is concerned, that the man does not have erection is that they've never had sex for several months. It does not necessarily mean the man does not have erection. It could be directional to the woman in question.
So it
may not be universal.
So it could be a psychological component. Is that what you're saying?
Yes, because things that have to do with relationship are social, psychological.
Okay.
Relationship. Yes.
Okay. So I'm assuming that you have a way of ascertaining whether a person is actually incapable of performing the sexual act as opposed to incapable of performing the sexual act with regards to this particular individual.
It's because I would say yes, because when you interview a man who has problems in the sexual relationship with his partner or his spouse, you would want to find out from him in privacy, alone, if he actually has erection at all. If he doesn't have erection at all, when last did he have sexual intercourse? With who? I've met a man who for 10 years did not have sex with his wife, but he actually had a partner living a few blocks away from him. And he was having sex with the woman 3 times every week for 10 years.
Oh my God.
Before the wife, there was no sexual activity at all.
And so she thought he was basically important.
And the problem was a problem of discord. And when I wanted to interview both of them together and try to see if I could help them resolve their problem, the man said that he didn't believe the woman would like to come to see me. And even if she came, there would be a lot of argument about the facts. So when the woman came, and I was trying to explain that I've examined the husband, I have carried out tests on the husband, and I never found any problem, and that I would like us to look at all the things that could cause this problem, in particular the relationship between her and the husband. And then the woman was like, okay, so I'm trying to tell her that she has anything to do with this. You are trying to tell me that I'm the cause of this. This is a man's world. And this is all that if this is all that you have to talk about, I'm just walking out of a consulting room right now. Let me just tell you, gentlemen. And she left. So the man said, yeah, this is what I told you. The woman is like a tigress, and she wouldn't want to listen to anything. She wouldn't want any conversation on this matter at all. She just believes the man has a problem. And so the man is having difficulty getting across to his wife, and he decides to help himself.
To satisfy
as far as the woman was concerned, the man couldn't have erection. But having interviewed the man alone, I knew that there was no problem at all. As a matter of fact, all the tests were normal.
Speaking of, let's talk about some of the tests. What are some of the general tests you perform on a person to ascertain whether it's a physical problem or a psychological problem? Are there some simple tests?
You know, when we talk about tests medically, we are not just talking about things like blood tests, urine tests, body secretions. We are talking about everything about the human being. As a matter of fact, the World Health Organization defines health as a state of physical, psychological, mental, social well-being. It's not just about physical.
Right.
The common tests that are done in the hospital, in a typical hospital, are physical tests, are biological tests.
Okay.
But here we are going to assess the psychological well-being of the patient or the man. So there are psychological tests, there are physiological tests, there are anatomical tests as well.
Okay.
Psychologically, we're going to evaluate the patient, if there are any social issues, marital discord between him and the wife. Anatomically, you're going to examine the patient to see if there are any things you could find on physical examination that you may not necessarily find when you do tests. And then, of course, there are physiological tests that you will do, which may include blood tests, urine tests, and so on.
Interesting. I want to touch on a few more things maybe when we come back from the break, but at this point we have to take a quick break, so we will be right back. Stay tuned, folks. Okay, welcome back. Just before the break, we were talking about some of the tests need to be done, questionnaires and all that. But I want us to take a step back, Doc, and let's look at the different causes of impotence, not male impotence, but of impotence, and what needs to possibly be done. From our discussion, it seems to me like in your practice, psychosocial seems to be top on the list for why men do not perform to their wives' or their partner's satisfaction, right?
Yes, from my experience and from the people I see, the psychogenic aspects account for the majority. But this varies from age to age.
Okay.
For younger people, most of the time it is psychological. And then for older people, after the age of 50, 60, you begin to see a lot more organic problems. Organic problems organic means problems that are actually real. Medical issues, surgical issues, like the common one is diabetes. Diabetes affects blood flow to certain organs in the body, the heart, the brain, the kidneys, they suffer a lot. And sometimes blood flow to the penis is also reduced because diabetic people have a lot of oil, a lot of cholesterol in their blood, and that gets deposited on the blood vessels. And then that affects, apart from the blood vessels not carrying enough blood to the penis sometimes, You can also find that the blood vessels supplying the nerves that control erection are equally affected. So the nerves cannot respond anymore to sexual stimuli. There's a connection between the brain and the nerves that control erection. From the eyes to the brain, everything, all the senses connect to the brain, and the brain sends impulses to different organs in the body. So when the nerves cannot conduct those impulses adequately, then there is a direct impact also.
And that's because of diabetes?
Because of diabetes.
Acting on the nerves or acting on the blood vessels?
Both of them.
Acting on both. Them. Okay.
And, so that's one cause, one organic problem. Yeah. The second organic problem is hypertension. Hypertension on itself causes problems with blood flow, causes problem with different parts of the body. And then the drugs that people take for hypertension, many of them lower the pressure on the blood vessels by acting on the nerves or acting on the chemicals that they are released at the ends of those blood vessels, which stimulate the blood vessels to contract and cause hypertension. So when those chemicals are affected, some of those chemicals also are involved in erection. So when those chemicals are depleted or are blocked from their usual activity, sometimes there is problem with erection.
So this presents a big problem, Doc, because if a person has hypertension, he has to use his drugs.
Yes.
And if you are telling me that both the hypertension and the drugs will cause a decrease in sexual empowerment,
yes,
that leaves us with a big problem.
It's not a universal problem. That is, some people respond in a different way to certain drugs. And so when you get back to your doctor, you can take a look at the drugs and see which one might be causing problem. You could prescribe some other drugs that cause less problem than the one you are taking. But Doc, the main problem about erection,
yes,
the main problem, the number one problem is psychogenic. The majority of people have psychogenic problems. Then, apart from drugs I spoke about, even alcohol qualifies as drug, cigarettes qualify as drugs. Recreational drugs, they all cause problems. So when people abuse drugs, they take recreational substances like cocaine, they can end up in problems as well. And there are some other drugs that are not even for hypertension, they are for other problems people have, like cimetidine, which is used for peptic ulcer. Sometimes it causes problem with erection. There's so many drugs. So when people have problem, they cannot make an assumption that it's their age or it's a particular drug they're taking. They have to go and sit down with the doctor and talk to their doctor. And sometimes, like I said, somebody may be on medication, but there's a social problem between him and the spouse. There's disagreement between him and the spouse. There's discord. Maybe the woman is gaining so much weight, or maybe the woman is no more as attractive as she used to be, but the man's taste is different. And when couples do not communicate, people have fantasies, but they're afraid of communicating their fantasies. So they prefer to go out and look for somebody out there who can satisfy their curiosity, instead of having the boldness to discuss their fantasy. And sometimes a man will have a fantasy and he discusses it with his spouse, and the spouse flares up. Yes. But the same spouse has the same fantasy, but she doesn't want to come to a level of accepting that that is who she is, because the man may look down on her. It's quite a complex situation, you know.
I can imagine.
I met a young man who was having sexual intercourse with different girls every week, but he never stayed with the girl he was getting married to. And he was having an infection, and he was getting married, and he wanted the infection to be treated. He didn't want the woman he was getting married to know that the infection was sexually transmitted. And I was like, why don't you want her to be treated also? And he said, no, she doesn't have infection. How do you know? Because I've never slept with her. Why are you sleeping with other girls and you're getting married in a few days? Because I respect the woman I'm getting married to so much that I cannot introduce a topic of sex until the day we are married. This is hypocrisy, and this is what we all like. You know, you want to pretend to be a saint. Yeah. But right in your heart, you are far from that. Yeah. And then you begin to fantasize. You are looking for people out there that can satisfy your fantasy. You don't want your partner to know that this is who you are. Yeah. This is hypocrisy. Yeah. You should be real. So somebody could be on medication, but it's not the medication that is responsible for the problem he has. It may well be that his fantasy is not satisfied, his curiosity is not met, he cannot find anybody that can help him out, and then he looks for somebody out there that could help him out. We should be real, we should be who we are.
I think you bring a very, very important point, and that's that whole communication, being able to communicate and all that. But I don't want us to leave it without leave it at just the psychological alone, because there are people who genuinely just cannot perform, and it's you've mentioned, of course, the organic reasons and all that, and we want to make sure that before the show is over, I want to say, okay, what can be done to help these people, whether it's through the doctor himself or what the person at home can do.
In my practice, I first of all listen to the complaints a patient has brought.
Mm-hmm.
And I take time to find out when it started, how it started. Is it universal, or is it with one particular partner? Does he have another Caesar partner? I look at all these things, and I talk to the patient alone. And I expect the patient to be honest with me. And then I will examine the patient. When you examine the patient, you find problems. I've seen people who do not have any testes at all. They have lost both testes to torsion, and they saw the wrong doctor when they were having pain in the scrotum. The doctor thought it was infection, they were pumping them with antibiotics, and they had torsion. And the doctor never recognized it, and he never sent them to a urologist. And then after some months, they had pain on the other testes, and the same doctor is giving the medicines. Then they, on second thought, they decide to see a urologist, and they discover they have lost both testes. And after that, they will not have erection anymore. If you castrate an animal, it will not have any erection.
Right.
So sometimes it's due to testicular problems. If the testis is also damaged right from the womb for certain things that sometimes are difficult to define, maybe intrauterine torsion, they call it vanishing testis. The testis is lost inside the womb or is damaged from trauma or from varicoceles. It begins to atrophy, to reduce in size until it becomes like a being, like the size of a being. At that time, the amount of testosterone that comes out of the testis is so small that the person never has any erection anymore. I see people like that. People that have liver problems do not tend to have a problem with erection too, because it's in the liver that estrogens are converted to testosterone.
Right.
By the way, men produce estrogens like women. They produce progesterone like women.
Yeah.
But their estrogens are converted to testosterone. In the women, the enzyme responsible for conversion of estrogens to testosterone is deficient.
I see.
And that is why they have a lot more estrogen. The women also have the male hormone, but the level is very, very low.
Okay.
And so if a man, testosterone, estrogens cannot be converted to testosterone in the liver, then the man will have a lot of estrogens building up in the circulation. The testosterone level will be very low. The estrogens will now inhibit the pituitary gland from producing hormones that stimulate the production of testosterone. Meanwhile, testosterone is not being produced. And so the man's testosterone level is low, and then the man stops having erection because of a liver problem. I once saw a patient who never knew why he was having problem with erection. But when we finished evaluating him, we discovered he had liver failure. That was the first time he knew he had liver failure. And he's no more alive. He died from liver failure.
Oh my goodness.
But the problem he had wasn't because the testes were diseased. The testes couldn't produce testosterone. The problem was that the testes produce the hormones. Adrenal glands produce all the hormones that are required in the system. But the hormones are building up as estrogens. They are not converted to testosterone in the liver.
Oh my goodness.
And so the liver had failed. And so he couldn't produce testosterone. So you look at the whole picture, not just, you don't assess patients based on any assumptions. You look at the whole picture, you listen to their story. Is it libido that is a problem, or is it erection that is a problem? Some people have problem with libido, not erection. When they're stimulated adequately, they can have normal erection, and they can have sex normally. And by the way, people think that men do not need to be stimulated. The moment they see the woman that they like, they will have an erection spontaneously. People forget that men are human beings, just that the woman is a human being. Most women need to be stimulated before they can be ready for sex. So if you meet a woman and you want to have sex and she's not stimulated psychologically, socially, physically, and you want to penetrate, she'll be dry.
And she might end up hurting her.
Yes, that is the same way a woman needs to be stimulated. A man also needs to be stimulated. At a very young age, before the age of 25, 30, most men can have erection normally when they see a girl they like. Even without talking to the girl, they can start having erection.
Which brings me to a point, Doc. Sorry to cut in, but we do need to talk about this whole graduation from puberty when the testosterone levels are at their peak, and then go into their 30s, their 40s, their 50s, and the 60s when this begin to diminish, because that also plays a role in both libido and erection. Like,
Yep.
so is that sort of a solution to some of the psychological aspects that we've talked about? Do they need to go for sexual counseling or watch a few training programs on how to have better sex, expose themselves to different experiences? I mean, how do you put that sizzle back in the sex?
I would say they need everything you've said.
Okay.
I would say they need everything, because as men grow older, they no longer have spontaneous erection the way they used to when they were 25.
And that's because the testosterone levels are
Yes,
low.
everything. They also
Low.
have a lot more social pressure.
Okay.
Between 40 50, men are at their peak. When it comes to their career, when it comes to job requirements, they spend more time in the office, they come back home more tired. That is not the time the woman who has been home earlier will expect the man to do all the job. So if you are married, a man is married to a woman who is not interested in doing any experiment, is not interested in stimulating him, just like he will want to stimulate her, there will be a problem. And so even the woman, when she was younger, just kissing a man will make her so wet. It's not the same thing which is already approaching menopause or she's menopausal. As a man needs to make more effort to stimulate the woman needs to make more effort to also stimulate the man for erection to come, for erection to be sustained.
I see. Okay, so other than the physical act of stimulation, are there other things too that can raise their level of expectancy? Or, I mean, I don't want to say drugs, supplements, food, anything in that regard that makes a person more primed, so to speak?
You know, generally, sex is not a primary need for any animal. Sex is one of the secondary or tertiary needs. All the other needs are usually satisfied before any animal is in the level or in the mood for sex. If a man is having a trait of being sacked from the office, or the man is losing his job, or the bank account is dry, the children are out of school, you know, he needs a lot of psychological encouragement from the wife. So when I talk about stimulation, it doesn't mean that is all that needs to be done. If the man has any organic problems, he needs to be treated. The man has malaria, the man is down physically, cannot even get out of bed. That is not the time the wife will expect everything from him. So it's supposed to be a conjugal function, where one partner helps the other partner back on his feet.
There you have it, folks. That's I think I like what you quoted from the World Health Organization. It's not just the absence. Health is not just the absence of disease, sickness and disease, but the whole being. That is the spiritual, the mental, the physical, the psychosocial aspects of it. I mean, and I think that comes into bear when you're talking about sex as well, because it's not just the person performing sexual functions like an animal. Maybe that could happen when we're in our teens and early 20s, but as we go on, it's not the same thing. But Doc, we have to have you back so we can talk more.
I don't know why they like to interrupt you. We'll have just continued. They will not take up aspects that you like, you know?
I'm telling you. Well, we'll do that in the
It's a
next
big topic.
show.
You can't finish it in one day. You cannot.
We'll try and go a little bit further in the next show.
Yes,
How's that?
It's a very big topic.
Right. Doc,
Because
thank you so
when we
much.
talk about treatment,
Yeah.
when you're talking about psychotherapy, sexual therapy, you have to talk to both the couple together.
Yeah.
When you talk about physical things that need to be done
Yeah.
for people that do not have physical problems,
Yeah.
when you talk about the general health of the individual.
Yeah.
If somebody is sick, you don't flog a dead horse. If somebody is sick, we have to get him treated before we now start talking about erection.
All right.
And then when it comes to medicines, when everything else fails,
Yes.
that is when you move to medicines, or to make him to be stronger. Generally, blood level is low.
Yeah.
The person is not generally not healthy.
Yeah.
Maybe it's just vitamins in it. Person's hormones are low. You need to give him supplement hormones.
to supplement.
Sometimes tablets work. Tablets that stimulate.
So we're going to
So-
have to round up at this point. But folks, thanks for joining us for the show, and we will see you next week. Thank you again, sir. Doc, I really appreciate it.